Are there ethical issues in palliative care? Imagine facing a moment when your loved one is seriously ill and nearing the end of life. Decisions about their care can become very complicated, raising important questions about what is right and fair. That's where ethics come into play in palliative care. These ethical issues are part of everyday practice because caring for someone at the end of life involves balancing many principles. One of the main principles is respecting what the patient wants. This is called autonomy. It means honoring their choices about treatments like resuscitation or artificial nutrition. But sometimes patients can't speak for themselves, so family members or legal surrogates step in to decide. Conflicts can happen if families disagree or if healthcare providers think a decision isn't best. Healthcare providers also focus on doing good and avoiding harm. This is beneficence and non-maleficence. They aim to relieving suffering and keep patients comfortable. But ethical questions arise when deciding whether to stop or withhold treatments that might prolong life. For example, giving strong pain medications like opioids helps with pain but can also hasten death. Balancing symptom relief with the risk of shortening life is a delicate task. Justice is another key principle. It's about making sure everyone has fair access to palliative care, no matter their background or income. Sometimes disparities exist, and that raises questions about fairness and equality. Communication plays a vital role in addressing these issues. Clear, honest talks help patients and families understand options and set goals. Good communication reduces misunderstandings and supports ethical decisions. Regular family meetings and advanced care planning are tools that help everyone stay on the same page. Legal rules also influence ethical choices. Laws about do not resuscitate orders or medical aid in dying guide providers. When disagreements happen, ethics committees can step in to mediate and help find a fair solution. Specific challenges include avoiding unnecessary or overly aggressive treatments that may cause more suffering. Managing opioids responsibly is important to prevent side effects or addiction. Respecting cultural and spiritual values of patients and families is also essential. Sometimes, patients' autonomy might be challenged if they are unable to make decisions, which requires careful ethical handling. In practice, palliative care teams work hard to follow these principles, always aiming to provide compassionate, respectful care. They often hold discussions with patients and families, seek ethics consultations when needed, and ensure that care aligns with both medical standards and personal values. Ethical issues in palliative care are complex, but with ongoing dialogue and teamwork, they can be managed in a way that honors the dignity of each individual facing the end of life.